We'll jump into it here quick, and hopefully everything's working. So just want to, again, welcome everyone, and we want to talk a little bit about what matters for IVF success. And so this first slide, just kind of setting the stage for the discussion tonight. So we're going to go through a few, what we call the glossary of terms. And so just so everybody's on the same page with some of the acronyms or terminology that we're going to use, we'll cover a couple quick things there. And then, kind of what we want to accomplish with tonight is, why is IVF a game changer in small ruminants? What is the definition of success? So we are all seeing the numbers the same. And then what are the things that we need to be doing to have success with it? And then probably the last disclaimer is, this data that we're presenting tonight is all data that was generated from RSG here over the last 5 years with the evolution of this. And so over that 5-year period, we went from starting with low to minimal to poor results, and learning each of those steps of the way. And so now we've reached a point to where we feel like we have a commercially viable product. So in many publications, literature, and even in tonight's presentation, we'll talk about ART, which is also what my 8-year-old daughter does in school. But in this situation, it's going to be advanced reproductive technologies. And so that's going to encompass several things, which is going to be artificial insemination or laparoscopic AI, embryo transfer, which by definition will be the actual transfer of the embryo from the dish into the recipient, IVF being in vitro fertilization. You'll also see us refer to OPU or LOPU. So that's the laparoscopic ovum pickup. So that'll be the actual process of aspirating the oocyte from the follicle. Hi, Gabriella. Good to see you. And then, of course, donors being the females that we're going to take the oocytes from. Recipients will be the ones who are going to carry that. MOET is one of those that's often seen in literature that sometimes is maybe not completely understood. So that's multiple ovulation embryo transfer. And so that would be the conventional embryo transfer that the most small ruminant folks would be familiar with. Viable embryos are embryos that are of transfer quality, because in all procedures, whether they're IVF or MOET, we will have embryos that are not viable, not transferable. So we just want to make that distinction between what a viable embryo will be called. Development rate, so that's that oocyte to embryo. So within that process, there's obviously the oocyte has to be fertilized, but then it also has to develop to a viable embryo stage. And Mallory's going to go through more of that here in a few minutes. Pregnancy rates are going to be what we're confirming is pregnant within the recip from the ultrasound. And one of the slides here later on, just to kind of tee it up here a little bit. So the pregnancy rate of the recip does not always indicate embryo count if twins were transferred into the recipient. And so we have numbers here a little bit later that will refer specifically to the pregnancy rate of the recipients, and then also the fetal counts from that standpoint. So that distinction will come out here a little bit later. Synchronization is just getting the heat cycles or the estrus cycles in alignment. Superstimulation being the phallotropin or the FSH, the follicle stimulating hormone that we will use. We're going to talk a little bit about seasonality, and it's kind of interesting in this industry these days. We talk way less about seasonality than we used to. So back when I first knew Deb Gorley and we were doing AI and ET at the Purdue Center, seasonality was much more talked about, because we were doing all that work in September and October and later in the year, not in June and July. So seasonality is still a big factor that we'll talk a little bit about later. Of course, out of season, and then fresh versus frozen. Excuse me, I'm not contagious over the mic. I apologize for that. Semen quality, we will talk a little bit about motility, morphology, and concentration, and the importance of morphology in the IVF field. So just a few quick definitions for everybody there. So ultimately what we want want to make sure that everyone's aware is that IVF is another tool in the toolbox. And so I've had questions about, why is IVF better than MOET? Why is it preferred? All those kind of questions. And ultimately, it's not better than MOET. It's not preferred. It's another tool. It's another option for advancing reproduction, advancing our time. And so, want to stress that here as we go through tonight's slides. So, ART is the success of ART is a year-round commitment to animals and care and management. And so, it doesn't matter if we're talking about artificial insemination, conventional embryo transfer, or IVF. Those principles are still all going to be key to the success of that. And so what is that success? That's increasing the number of offspring or genetic gain and shortening our time frame. And so ultimately, why would we do AI? Why would we do embryo transfer or IVF? It's all about genetic advancement, shortening our generational intervals, and those factors. So I want to share this slide here, and it talks about the hierarchy of needs. And I think one of the main things to point out is at the bottom of that pyramid is genetics. And so, back in when we were doing this stuff early on, and we were predominantly doing, frame Suffolk sheep, they were genetically more seasonal than a Katahdin hair sheep is today. And so genetically, there's only so much changing. There's only so much advancing we can do with their conception rate, their seasonality because of their genetics. And so genetics is something we always have to think about and consider and what that impact would be. So then when we move up to the next level or level one, we start talking about physiologic needs, and that's just the basics of life, right? So is the animal, what's the air quality? How's our nutrition playing? Are we able to be in a safe environment? All those kind of things that allow the animal just to be a animal that's healthy and doing the normal animal things that it needs to. And then level two goes up there to that stress component. So if that animal is in a situation where it's under a constant amount of stress, fighting with temperatures or different environmental things can impact that stress level. That'll also affect us on the reproductive front. And so then at the very top of the pyramid, of course, that's reproduction. And so reproduction is a luxury. It's not a need. And so we need to make sure we're doing all those things at a base level before we can look at having success at the top of the pyramid. So we're going to spend a few minutes here just talking about the IVF process. And so we're going to start with what an OPU is, and then we'll kind of walk that through to the transfer of the embryo. And so donor selection and estrus synchronization. So obviously a donor is what we're going to identify as a genetically superior animal. And then we're going to go through a stimulation protocol. So when you compare IVF to MOET or conventional embryo flushes, it's going to require about half of the volume of thallotropin stimulating hormone or FSH. And so that's one distinct difference between IVF and MOET. But then when you get into the synchronization protocols, that's what you'll see there kind of at the bottom of the screen. We're still going to use a CEDAR. We like to give an injection of GnRH to do, at that point, what would be considered a dominant follicle regression or removal. So if there's any dominant follicles that are sitting there, we're going to go ahead and knock those off so we have a little more control of that phase of the cycle. Prostaglandins, depending on our CEDAR period, old corpus luteums aren't as much of a question or worry for us because they're sitting there making some progesterone, which in this situation isn't going to hurt us. I do like to give prostaglandin on aspiration day, just purely to reset the system and their ovaries. And then, of course, phallotropin is going to be key to that. So phallotropin will be the stimulating hormone of choice here, and particularly in the U.S. There's another drug out there called Oocyte, which many of you may have heard when here a couple of years ago when phallotropin was in short supply. There was a conditional licensure to bring Flucet into the country. Flucet was used in pretty much majority of the rest of the world has access to Flucet. It's a different combination of FSH and LH. So if it's still floating around, it can be used. It's just a little different hormone combination. So pictures here to the right, the very top picture there is an aspiration that we're in the process of doing. But I wanted to show those kind of blisters on, those are abattoir or slaughterhouse ovaries that have been removed from the animal. And so those blisters on there, those are the follicles. And so within those blisters or those fluid-filled sacs, that's where the oocyte or that unfertilized egg is at. And so that's what we're there looking for. So then probably one of the biggest obstacles to overcome for us has been, not IVF's not only for problem animals. And so in a lot of ways, we've had folks kind of start with their problem animals to go the IVF route with, which is not bad. There is a place for them. But it's most valuable when we can utilize that in a regular production system with healthy, reproductively sound animals. So with IVF, we're going to be able to increase seasonal fertilizations. So within that, we're going to be able to repeat the IVF process every 3 weeks, where with MOET, we're going to be every 6. And so there's a little different interval of that. And then each time with an aspiration or a fertilization, you can use a different sire with IVF. It's pretty popular in older donors. So sometimes we've had several situations where donors maybe are less productive as they get a little bit older. Maybe their conventional flushes are decreasing in the number of embryos they're producing. And when we go into an IVF situation with them, we can still get the good stimulation or development of oocytes and follicles on their ovaries, and we can take them off before the system and the uterus and everything has to do the second half. And so in a conventional program, they come along, we have the follicles, we inseminate them, then they have to ovulate, fertilize, and develop those embryos in the uterus in a MOET program. So if these older donors are maybe failing on the second half of that cycle, then we can go in there with IVF and take those out ahead of time and fertilize them in a dish. So we've had some really good success with some of those older donors. Adhesion cases. So this is some of the problem children that we get into is, so particularly in the boar goats. So kind of the higher body condition or fat boar goats tend to create more surgical adhesions with MOET. And so there's a lot more situations where we've had those does come into us where we can still access their ovaries. We can go ahead and get those eggs off those ovaries and get them into the dish. But in a MOET situation, there's too many adhesions or too much scar tissue to have good success. So that's been a popular use for it. And then post-pubertal younger animals. And so just to clarify that, we're not really getting into, at this point, pre-pubertal animals. There has been a lot of work done with them over the years, and we will continue to work on that so we have something to share later on. But at this stage, those pre-pubertal animals are not what we consider a market-ready option for you. But those doelings that are maybe sub, 10 months old, their uterus is very delicate, fragile. We don't want to have to go through a conventional MOET program. We like those as IVF candidates. And then particularly in the sheep world, those ewes tend to need to be quite a bit older than even the doelings. And so looking at those, 12-month-old ewe lambs, 10's a little on the early side for ewe lambs, but you get into those, by between 10 and 12 months, they start to have their first cycle or their first estrus period. And then after that, we could look at doing some aspirations on those young post-pubertal ewes. So that would be another candidate option. So what's this kind of look like? Just running through this. So, pre-surgery, we've obviously already done our synchronization protocol. We are going to withhold them for feed and water for 24 hours. Sorry, guys. So it's still important to get that rumen and bowels emptied out. So off feed and water for 24 hours. We don't want to cause any issues there. They'll get a sedation to be cradled, and just like they would in a MOET procedure. We'll go ahead and clip and prep their abdominal body wall. And then we prefer, here at RC, what we prefer to do is general anesthesia. So I like to go ahead and put a trach tube in them and put them on gas. I know there's some practices that do it under injectable and have success. I think for me personally, I think having a controlled airway just creates a little bit of a comfort for us. We use propofol for our induction agent. So propofol is the white liquid that used to if you've been to the hospital for a procedure yourselves, you've probably been propofol. So the beauty of this drug is it works very quickly and has a very short duration, and so it's in the system and out of the system very quickly. So the good and the bad of that is it's very expensive. Is the bad. However, it's short acting, and so we can give it to the animal, put a tube in them, and put them on gas, and then we have more of a controlled anesthetic plane, and so it's just an increased level of safety. Injectables work fine, and I've used injectables, and we've been successful with them. There's just a little less safety in my hands and what I'm comfortable with. So we go a little step farther there. And then we'll have 3 ports, which I think you might have seen in one of the slides. There's another picture coming up. And so we have the laparoscope port to look through. On the far side, there's a clamp that's going to hold the ligament of the ovary, or the pedicle there under the ovary that attaches it to the uterus. And what that does is allow us to manipulate the position of the ovary. And then the third port is what we use for the vacuum or the suction pump to collect the oocytes. So once we get through that, then recovery-wise, it's pretty straightforward. With the general anesthesia, they wake up very quickly. We do go ahead and give a prophylactic antibiotic at the time of the procedure. We'll remove their cedar at that point. I also like to give a dose of estromate or prostaglandin, just because most of those have a residual CL sitting there. I just like that system to reset. Okay. At this point, I'm going to turn it over to Mallory so I can cough, and she'll walk you through the oocyte piece of it.
Yeah, so what do we exactly look for in the lab before we actually send them to the IVF lab? So once those oocytes are collected, we look for 2 different things. We look at the oocytes' cumulus cells, and we also look at their cytoplasm. So the cumulus cells, kind of an outer cloud, or what make the oocyte kind of look like a fried egg. Those cells kind of contribute to the quality of the egg as a whole. So what it can do is kind of help that egg mature, and it's a good indication on that oocyte's health. And so when we're looking at those cumulus cells, we give them a grade. So there's grade 1 for multiple layers, there's grade 2 for just a single layer, and then there's a grade 3 for whether the oocyte is bare on the side or completely what we call denuded, but a completely bare oocyte. And so with those gradings, we can kind of assess the quality of the oocyte, grade 1s being the highest quality and 3s being the lowest quality. And then we also mark grade 4s, which would be a dead oocyte at the same time. So in knowing the cumulus cell grade, we also look at the cytoplasm. So we're looking at that innermost circle, dark circle inside of that oocyte. And what we want to see is a nice uniform dark color through. And we want to not see any irregularities in that or spottiness. The spottiness can kind of tell us a little bit about the overall donor's health. So kind of like what Tad was talking about earlier, kind of that hierarchy. So the cytoplasm is going to kind of tell us how healthy that donor is. So stage of production is a really big one on cytoplasm quality, along with if the donor's been sick, and body condition score are all things that kind of affect that cytoplasm quality. And so we have given a group score on those donors' oocytes in terms of their cytoplasm. So we'd like to see about 80% of those eggs to have a high quality cytoplasm. 70 to 15% is about average, and then anything below 40 we would consider a low quality. And so low quality doesn't necessarily mean you'll get no embryos, but there is a reduced development potential in that, in knowing that. So next slide. So here's a really cool picture of putting oocytes next to embryos. These were 2 donors from last year. And as you can tell, both oocytes are very uniform. And that's exactly what we want to see. There's variation within those cumulus cells, but as you can see, the overall oocyte health of both of these embryos was high quality, and we were able to get some viable embryos off of that, which is pretty cool. Tapping into semen selection and semen quality. So just like in a traditional MOET setting, semen, we're going to look at the motility, the morphology, and then the concentration of the semen. And so IVF can tolerate lower motility and concentration, but morphology standards still remain critical for embryo development. And that's an important kind of thing to note. The fresh semen can be used, but it's not as advantageous as compared to those MOET programs. In goats, the frozen semen has been proven to be more productive in the IVF lab than in a conventional MOET flush. And then another cool thing with IVF is 1 straw of frozen semen can be used to fertilize across multiple donors. But it's not a direct comparison to MOET. The average number of viable, robust embryos is greater with a MOET per donor on frozen. So what does the timeline kind of look like with the whole IVF process? So once those oocytes are aspirated, within 24 hours, after 24 hours of the collection, they'll be in the lab and be fertilized. And so people who have been around the IVF world may have heard us talk about IVC. And what that means is once the oocytes get pulled out by the lab is going to do an assessment and pull out any dead oocytes that we sent that just didn't mature properly, and discard those. And then once fertilization occurs, those hopefully now embryos are going to be stuck into quote unquote mother incubators for 5 days. So it's kind of a waiting game for everybody. We just let those, the lab lets those embryos incubate for 5 days, and then they pull them out for either an assessment on whether they're shipping them back to us, or if they're going to freeze those embryos, kind of based on the process for those. One thing to talk about with the embryo grading, so there's embryos will grow at different rates, and so that can make predictions and shipping of embryos somewhat challenging for the lab and for us. And so we talk a lot about predictions when the lab is sending us. They're going to send us anything that was fertilized and was wanting to become an embryo. They're going to send it back to us. But those predictions don't necessarily dictate the number of embryos that we see the next day. So I know there's a little bit of confusion there. So that is how we do all that grading. Now the transfer is just like a MOET. So Tad's going to scope those ewes, look for a corpus luteum or CL. There's a nice photo of a bright red CL there. He's going to check those recipients that they have that, and then we'll go ahead and he'll pull that uterine horn out and we'll do the transfer just like we would in a MOET flush. The difference is we're pulling them out of the incubator rather than from those ewes in the morning. So that's all of this, that's all the same. The one big difference between an IVF and a MOET transfer is the media that is used. So IVF media is very pH sensitive. So there is not a whole lot of wiggle room in terms of time that those embryos should be out or be moved into different medias before they're being transferred. So we try to do this process relatively quickly, the whole assessment of embryos and into the transfer, just for the embryo's health. So kind of just like the MOET flush. So post-op donor management is very important. Even though this is a minimally invasive procedure, we still want to make sure those donors are being looked after the procedure. So putting them in a clean pen with some fresh bedding is kind of good practice, and monitoring those 3 punctures with first any swelling, heat, or discharge is just going to overall contribute to that donor's health and future. Antibiotics, we typically give them Nuflor the day of the procedure. And then like Tad was saying earlier, we also do administer estromate or prostaglandin post-procedure as well. So overall, what drives success for us would be equipment, environment, and also training. So equipment is a big thing. So a lot of the equipment we use is actually medical grade. Those oocytes are very sensitive, even more sensitive than embryos from a MOET flush. So we want to make sure they're maintaining a proper temperature through the whole process and that they're not being affected by any light or any nasty smells or things like that. And it just starts with the equipment. So if you ever come and visit us on an aspiration day, you may notice we're using a bunch of different warmers and there's a lot more equipment now. That's just us trying to make sure we maintain that 38 degrees or the body temperature of the sheep or the goat that we're working with. So all of that is very important for the success of these programs. And with that, also the environment is a big thing to pay attention to as well. If you ever come into the lab on the IVF day, you'll notice it's comfortably warm in there. So we intentionally warm up the lab just to keep a good working temperature for those oocytes. If they do happen to be out a little bit longer than we'd like, they're still in a good, safe environment. Likewise, we also tend to close the door of the lab, of the embryo room on aspiration day, just to kind of mitigate any dust or any aerosols that are in the air during procedures to kind of, once again, promote that safe oocyte health. And then lastly, training and working with our labs. So it's very important with this new technology. It's changed a lot and it's growing really fast. And so it's important to have the right lab partner and just keep kind of working away. So we've worked these last couple of years really hard on nailing down our SOPs to maintain consistency and doing this over time. And now we feel very comfortable doing this process and are excited for the future with it. So.
All right, so now we'll jump into the fun parts and some of the things that come out of IVF and what you as clients and producers can expect, not only from a embryo outcome standpoint, but also from a financial standpoint and what you might anticipate going into that as well. So big key point on this slide is that this data comes from the last 5 years of research and R&D and the procedures that we have done here at RSG, and that this data includes IVF services, superovulation meds, and facilities fees, but it does not include semen prices. So excluding semen in a sheep, your cost per embryo is going to be about $351, and in goats it's going to be about $278. And some that all comes from the services and the meds and facility fees and what you would expect to put into that, and we'll go through that in a little bit deeper detail here in a bit. But so for that cost, you should anticipate on the sheep side of things to get approximately about 10 oocytes per OPU. The range is about 9 to 12. Our average is hovering right around 10. And on goats, it's about 15, somewhere between that 14 to 20 range. That's what Mallory typically receives on the day of our LOPU. And then from there, it gets sent to the lab. And of those oocytes that we collect, somewhere between 25 and 50% of them will actually continue to develop into embryos. And that's where the embryos per OPU calculates from. So in sheep, it's about 4 to 5. In goats, it's somewhere between 5 and 6. And then, as Dr. Tad mentioned earlier, this is the point where the difference between the conception rate of the recip and the embryo to fetus comes into play. So from a recip conception standpoint, so if you ultrasound use or dose 45 days post-procedure, of those females, somewhere between 55 and 65% of them will still be pregnant and will have conceived per se. But that doesn't necessarily mean that all of those embryos were retained if you were putting in multiples. And so that's where that embryos to fetus metric really comes in. And so of those embryos that we put in on transfer day, so the 4 embryos in sheep and the 5 to 6 embryos per goat, somewhere between 45 and 50% of those will hold or stick, as we might say commonly in the industry. So
I think one quick thing to to kind of point out on the development rate line there on that slide for everybody is Mallory was referring to the quality of those oocytes. And so there's so many things that I know that 25 to 50 seems maybe like a larger range, but some of that gets to be determined by the quality of the oocyte that goes to the lab, but also gets determined by the semen quality that they get fertilized with. And so we do see certain sires that have a better development rate than others. And so there's a lot of factors that go into that. I think if you drop right in the middle, I think the beauty of where things are at right now in the IVF piece is, we're commonly seeing a 40% development rate. And if you look at the cattle guys who've been doing this for much longer than we have, we could put these numbers up against some of the best cattle programs that are going on out there. So for some of you, this might be the first time you're seeing these numbers, but from where they're at relative to the other IVF going on in the cattle species, I'd say we're in pretty good shape. So. Dr. Santiago, do you want to join on that?
I think we're good. And so Dr. Tad also mentioned seasonality earlier. And so IVF is less seasonally dependent than MOET is as a whole. However, we still see that seasonal improvement. So like Dr. Tad was mentioning earlier, we're going to see better numbers and more success into the fall and into the winter, September through November and into that time frame, as opposed to July and August and June and early on into those summer months. Sheep and goats, small ruminants in general, are short day breeders. And so as we continue to move towards that time frame of the year, we're going to see more success in all of our reproduction programs, regardless of which protocol or which program you're using. The other part of it is that donors don't have to necessarily be cycling. However, priming them improves results. So some pre-program and pre-protocol management is beneficial from that regard. And then sheep specifically, when it comes to seasonality, you will see a greater improvement into the fall compared to goats, and so those numbers will vary more in sheep than they will in the goats. However, you'll still see a change in the goats, and you will see them kind of continue to pick up as we go deeper into the fall and into that short day breeding season. And then as we kind of jump to stimulated versus non-stimulated. So Dr. Tad already mentioned in protocols earlier that the IVF requires only half of the amount of FSH compared to MOET protocols. So there is a difference in price there that plays into that, which we kind of just went over a little bit. And then some of that is also because we don't have to stimulate them quite as far, and we're not trying to get them all the way through as much as we are at MOET. In the cattle world, they will do IVF without stimulation, and that's something that we are going to continue to work on and continue to research. But as of right now, we don't feel that there is a marketable product, and we see much better success when stimulation is used and when we can control some of those things and control that piece of it better. And it does have an impact on oocyte quality and quantity when we do stimulated programs. But just remember that more FSH and more stimulation is not always better. There is a sweet spot. And so that's why we set our protocols the way we have them set. In terms of comparing species, there's a couple things down at the bottom that kind of compare species across the board. The goats are fairly well established, and so we're pretty confident in the results that we're getting from our goat programs, and we're happy to keep moving forward that. From the sheep standpoint, we think we have a marketable product, and we're excited to do more of that, but we also think that there's the potential in the future to continue to get better. And so we're going to keep working on that from an R&D standpoint internally and as a company. From an offspring size in cattle, when they do IVF, sometimes they'll see some of those calves get big in late gestation, and then they can potentially have issues calving. There are some reports that lambs will get larger, and that is more common with certain medias as opposed to others. And then from a fetal loss standpoint, that's another thing that kind of compares to the cattle industry that they've kind of figured out. Ultimately, we don't have any evidence of that, but we don't necessarily have evidence against it either. And so when it comes to getting more data and more herd management and getting more results to come back and all the way through, we'll be able to continue to make decisions and continue to learn more about that as we go forward. So. Dr. Tad, you want to go to the next slide?
Yeah, I was just gonna mention we do have a guest joining us. Dr. Santiago is one of our lab partners. I see you on the screen here, so feel free to jump in on any of this that you'd like to add to that we haven't covered yet.
Oh, thank you. Appreciate it, Todd. And no. All good. All good.
Perfect. So now we'll kind of jump into some financial numbers, some of the investment and what you should expect to pay for to come up with successful programs, as well as the efficiency, and then some of your return as well. So The IVF cost components, the laparoscopic OPU fee, that's a per donor aspiration based. RSG does have volume pricing available. Donor prep includes synchronization, meds, superstimulation hormones, and then pre-op management as is usual with any ART program. Semen, from an IVF standpoint, we'll talk about it more here in a minute, but one straw of semen can service multiple donors, which is different than what we see in MOET. And then there's a lab IVF fee that our lab partners charge, and it's associated with their efforts in terms of processing, maturation, fertilization, and culturing, and then their evaluation of those and predictions before they send them back to us. Shipping, incubator costs, overnight transport is required for the oocytes to the lab, and then as well as if you're doing fresh, the embryos coming back. And then recipient costs, just like in MOET, you have to synchronize them, feed them, house them, year-round care, just like Dr. Tad mentioned at the beginning. Reproduction programs and success is based on year-round management. It's not just a one-day event or two-day event in this as what would be in this program. And then the embryo transfer fee, which is when we take the embryo that we get back and then actually put it into the recipient. Those can be different from a fresh versus frozen transfer standpoint. Cryopreservation costs if you're going to be freezing. Obviously, there's a price associated with the freezing in of itself, but then also the storage when it comes to the liquid nitrogen and the tank maintenance there as well. And then post-op care, Dr. Tad and Mallory both mentioned this earlier, when it comes to pen management, keeping those pens clean, dry, all of those things, monitoring both the laparoscopic sites when it comes to donors, but then also the transfer site and recipients is important as well. And then the round of antibiotics that we give day of procedure. And then veterinary oversight in terms of anesthesia, surgical support, and recovery. So we've kind of hinted at it a couple times, but to dive deep into it. So semen efficiency is certainly an IVF advantage. One straw of semen can fertilize oocytes from multiple donors in an IVF session because we don't need quite the volume that we need compared to MOET. So in MOET, we're going to use one straw per donor per breeding when we breed twice with frozen semen, and so that's going to be 2 straws per donor, whereas in IVF we're just going to have 1 straw. We can use it across multiple donors, and that's part of what makes it so hard to factor in semen costs into some of this cost analysis, is that you could take 1 straw of semen and branch it across multiple different IVF aspirations. So the average production with IVF is approximately half the number of embryos versus a MOET. So you're using potentially half the semen, potentially even less for IVF, but you're only going to get half the number of embryos compared to what you would get with MOET. IVF embryos are less robust, as Mallory mentioned earlier, and so semen is not as significant in terms of the net difference of embryos that actually end up turning into babies and then end up as live lambs or kids that actually hit the ground. A lot of that is based on oocytology and how that looks and what Mallory thinks of those oocytes on the day of OPU. And then so one of the big advantages that we see IVF having is for semen that is of limited availability, whether that's because the ram buck has passed on and we just don't have any more of it, whether that's for other reasons. We can utilize that semen across multiple donors, and we can really make good use of that and expand those genetics more than what we could with a MOET protocol. And then, as Mallory already talked about, we can utilize lower motility and concentration semen, but good quality morphology is still required. you want to go to that? Perfect. And then, so to kind of just bring that all together, the costs and success of IVF versus MOET. So we already talked about the dollars per embryo, and sheep for IVF at $351, goats at $278. From a MOET standpoint, the dollars per embryo is $154, and for goats it's $130. And so, but that then comes down to the embryos per OPU is 4 embryos per OPU and sheep, and 5 to 6 embryos per OPU in goats. In sheep, for MOET, the embryos per flush is about 6, and the goats are averaging about 8. And then we break that down into conception of recips and then the embryo to fetus, similar to what we did earlier. Again, semen costs are not included in either comparison. However, the big piece of this to remember is that you can do IVF every 3 weeks, whereas you're going to do MOET every 6. And so you're going to essentially do 2 IVF procedures. You could potentially do 2 IVF procedures for every 1 MOET procedure. And so that allows that IVF to potentially become more fruitful over time. Again, at the end of the day, cost per live offspring is the metric that matters most it's what should matter most in all of our businesses and production schemes and production in general. And so one of the things that you should do in your programs as you go is, from a tracking standpoint, is to track oocyte yield, then development rate and pregnancy rate, and then fetal loss all the way out, to end up with a live rate and then a cost per live lamb or kid. So then to kind of just touch on MOET and what that looks like from an embryo transfer standpoint in sheep and goats. So we average about 6 embryos per flush in sheep and 8 embryos per flush in goats. You can use either fresh or frozen semen. You can bank frozen embryos on elite matings as an insurance policy. And then we've done MOET countless times. We've got plenty of repetition to confirm embryo transfer's ability to achieve strong results, and we're confident in those results and what we can do from that standpoint. So to then kind of summarize IVF and embryo transfer together, if we want to jump to the next slide real quick. So procedure. So the differences between IVF and MOET is that the IVF is just 3 small punctures like what you saw earlier in the presentation, and then the MOET is a surgical incision flush. And then from an IVF standpoint, you can repeat that every 3 to 4 weeks. MOET, you're going to repeat every 6 weeks. From a semen standpoint, in IVF, you're going to use 1 straw across multiple donors, and for MOET, you're going to use 2 straws per donor. The average number of embryos is from an IVF standpoint is approximately half of a MOET per IVF session. And remember that you can essentially do 2 IVFs in the same amount of time as you can do 1 MOET. So at the end of the day, you're coming fairly close to averaging about the same number of embryos over the same course of time. In sheep, the MOET averages are 6 embryos per flush. In the goats, it's 8 embryos per flush. Donor access, from an IVF standpoint, if the females have adhesions or if they're getting towards the end of their flushing careers and you're seeing a decrease in results, you could potentially, they are still IVF candidates. From a MOET standpoint, we need a healthy track required, and you're going to want to target those females that are still producing high volumes of embryos. From a longevity standpoint, IVF in general has less adhesion risk, whereas MOET, with the cumulative surgical risk, there can potentially be more risk for adhesions, and from a longevity standpoint. And then from an embryo strength standpoint, Mallory touched on it already. Those IVF embryos are just more fragile in general, and that's why the semen can be less of a factor in that, even though it still has to be of good morphologic quality. And then from a MOET standpoint, the embryo strength is more robust. From a species standpoint, IVF in goats is fairly well established. Sheep are just really hitting the ground running, and we expect to kind of continue to improve over the next 2 to 3 years on that side of things. From a MOET standpoint, both sheep and goats are established, and we are confident in the results that we're getting out of those programs. From an output per year standpoint, as I mentioned earlier, with continued frequent collections, you can actually end up with more embryos per year from an IVF standpoint. And that's mostly just due to the interval, that 6-week interval that is required between flushes. And then from a seasonality perspective, IVF has less dependence, but can still have some impact. And we will see better results into the fall than we will over the longer days in the summer. And then from a MOET standpoint, with synchronization protocols, we can see similar results regardless of seasonality. But Dr. Tad, you want to?
Yeah, I was going to jump in here real quick. We just had some really good questions pop up on our chat. So I want to just address those before we move on from here. And so Sheila Stern asked, are sexed embryos possible? And so what I would say is yes and no. So currently in our so you can sex embryos. That's currently not in the lab options for what we're doing right now. It's done on the cattle side in certain situations. We have RSG New Zealand is actively doing biopsies in dairy cattle embryos down there, and then they're vitrified and transferred. And so, but in that situation, there is a death loss that goes along with those embryos. And so, what we would share with you on the sexed embryo side is a few years back we had a project going with Sexing Technologies where there was a certain number of rams and bucks that were the semen was sex sorted, and we were not on a conventional use of that sex sorted semen from back then. We were not getting near as good of results as we were with conventional, and so the math didn't work out. However, we've been able to go back and use some of that sex sorted semen in Dr. Santiago's lab with good success on the sheep side. And so goes back to that semen slide here a few slides ago, where in that situation we may only have 2 to 4 million cells relative to 30 million cells in a conventional straw of semen that we were using in an IVF lab, where we're actually just putting those sperm cells directly into the drop. And so we've had some success with it. It's not just a readily available service. In some of the cattle labs, you'll hear about reverse sorting, where they'll take straws of semen, conventionally frozen semen, reverse sort those, and use those to fertilize IVF embryos. So the technology's out there. It's still evolving, I would say, in the small ruminant world. Dr. Santiago's lab is leading the way on sheep, especially with the development rates that he's achieving through his lab. And so as we continue to work together on these things, I'd sure like to see sex semen be more readily available for clients. You want to jump in there, Dr. Santiago?
Yeah, so now that's very nice that you touch that point because we've been having really good success with the sex semen so far. The only downside we're seeing, as you just mentioned, is that the straws, the concentration is pretty light. So at the moment we're using one straw basically per donor, because it's so light that it's not enough to do multiple donors. So if people or clients are thinking to use it in the future, we will need one straw per donor. And to be honest, the success with the sex semen has been very, very good. So that's very positive for the market, especially knowing that sometimes, as happens in cattle IVF procedures, the IVF systems benefit more the male gender. you're always going to be a little bit higher on the male side. So especially for operations that only want females, I think that's a great tool.
Yeah. Perfect. All right. We'll jump into here, thinking a little bit about, and it's great that Santiago is here with us, talking about the future and continuous improvements. And I think that's kind of been one of our mantras, if you will, for RSG all along, has been never to settle for where we're at and always continue to grow and evolve. And so I think that we'll continue to see that, and working with great partners, we will continue to be able to push and evolve the small ruminant IVF world. I do, in the very near future, I do see us having some practitioner training courses, ways to get more oocytes generated to get to the labs and be able to continue to grow. I think the size and the scope of the United States is quite large geographically, and so we're working through those logistics of when we're working with our clients in Georgia. How do we get those oocytes to the lab, and how does that process work? And so there's a lot of work going on there in the future of that. And I think, the IVF world, as far as where it's heading, I think it's going to just continue to grow and evolve. There's always going to be a steep growth curve, which is I think we're at the beginning of it now. As more and more clients get the opportunity to utilize it, they're seeing the value in it, and as we do more, we'll continue to improve and get better. So to touch on some of those emerging technologies, I think we already just talked on that. We probably will continue to see a little bit more on the gender sorted semen. Interestingly enough, in the cattle world, they want females, and in the show stock world, we still want males and females. And so that drive for one specific gender over another it's not been there in the small ruminant world. And that's what we ran into 5 or 6 years ago when we were doing our sex sorted project. Then was the castrated males have almost as much value as a female. So but I think as the IVF world evolves, we'll continue to see that be utilized more. Again, I talked on continuous improvement. I think that's when you put like-minded people together to solve a problem, you come up with great results. And so that's where I think, speaking to what Dr. Santiago is doing there in his lab, and with what our team's doing here, it's been a great partnership pushing that direction. So continue to build that network is going to be important, and then always continuing to push animal health and nutrition. And looking at that year round, our clients will continue to have more and more success as we get more of that information out in front of folks. So, anything else anybody wants to share? Dr. Murphy, are you good?
I think we're at the top of the hour here, Dr. Tad, and I think you got through all the information. I know there are still a few questions, looks like, popping up here in the chat. We'll try to also follow up with those offline as well if we did miss some there. Appreciate everybody taking the poll as well. We had a great response to the poll questions during the meeting here. And want to remind everyone that if you did join late, a complete version of this video will be on the RSG YouTube channel, and you can share that with others to view as well that might not have been able to participate here this evening. Any final thoughts there, Dr. Ted, as we wrap up?
No, I think that's great. Really appreciate it. Everybody continue to reach out if you have questions or need any kind of follow-up. We look forward to talking to you. So appreciate it.
Great. Thanks, everybody, for joining us.